Good morning, Dr. Pamela here. This morning we thought we would take you through a follow-up visit with one of our patients. When I'm seeing your Instagram questions, it's obvious that you don't really know, many of you, what happens during a chiropractic consultation and visit. This is a follow-up visit. Our patient has been before, but we're just going to show you what you might be able to expect when you come to a chiropractor. First visit would be longer, of course, because I'd have to find out all your history, but this is a follow-up and it's a little bit quicker, so you'll be able to see roughly what will happen. So this is Malek, my patient, and she's really kindly agreed to come in this morning and allow us to film her treatment and consultation. So thank you, Malek, for coming.
Thank you.
And we will go ahead and talk to Malek about her issues today. So Malek, how have you been since the last time I saw you?
Since the last visit I has been alright, but from 2 days I woke up with neck pain, especially in the right side. Okay, and I think that it's like going down to my shoulder as well.
Okay, good.
Yes.
Well, not good really, but how did you do that? How did you, do you think
Actually, I woke up with that.
You just woke up?
Yes.
You hadn't done anything unusual the day before?
I swim, I believe.
You were
Yeah,
swimming,
I
okay.
was
You didn't
swimming.
feel anything go wrong while you're swimming?
No.
No?
No.
Good, okay. So maybe it's just the pillows or a bad night's sleep. Sometimes this can happen. Have you found that your neck isn't turning as well?
For the left side, I think it's turning better from the right.
Okay, we'll check that out when we examine you
All
in a
right.
moment. Let me ask you a couple of other questions.
Sure.
How much pain are you having on a scale of 1 to 10?
Right now it's 6/10.
Wow, quite a lot
Yes.
then. Have you taken any painkillers or
No,
anything?
no, I didn't.
Okay, it's a good idea not to take them, as you know, before you come. Then I can see the real extent of your suffering and pain,
All right.
and we'll be able to judge the treatment according to your real pain levels instead of pain levels with tablets included, if you
Yes,
like. Yeah?
yes, you are right.
So that's good. So the rest of your spine is okay today?
I believe so, yes.
You haven't got any low back problems?
No,
Good.
no.
And any headache with that neck pain?
Yes, yes,
Yeah?
I have from time to time.
I know
Yes,
you-
right now it's not, but this morning, yes, I had.
Oh, you had some this morning.
Yes.
Okay. So then it gradually went away as you got ready and came. Okay. So as you know, neck pain sometimes gives you the headache. So we need to have a little look at those muscles that can stimulate headaches so that you don't get into that condition again.
Yes.
Okay, great. So now we'll go ahead and examine you.
Sure.
And see how you feel.
Okay.
Okay, so after we have done the talking part, the taking a little bit of history of the current situation on the follow-up, now we're going to examine her and see how her neck is moving first of all, passive movement first of all, and then we'll do a little bit of assisted movement and see how she's moving to the left and right and all the other directions the neck might move in. In her case, she hasn't got any x-rays because it's simple neck pain. She didn't have any trauma. She's young. She doesn't have any reason to take an x-ray at this stage. In fact, she usually gets better with a little bit of treatment quite easily. So at this point, no point in doing any x-rays unless she had something in her history that would determine that I needed that. Many people ask me this question, do they have to have an x-ray? There are certain reasons why you do need one, but in fact most of the time people don't need an x-ray or an MRI scan in that case. And you've got no pain going into your arm, correct? No. So she's got no radiating pain. If she had radiating pain, I might consider an MRI scan. But in this case, she is only having some neck spasm and probably, if it's like the last time, some of the vertebrae in her neck will be a little bit stuck. Okay, so let's see you turning to the left first of all. Okay, so that's almost full turning to the left. Now to the right. So you get a little bit stuck when you get to that point, yeah. So you can see the turning is different. Okay, and now if you can just bend your head over this way a little bit. Good, as far as you can go, good. Okay, so that's quite good. It's not pulling here too much? It is, okay. Now to this side. Okay. It's quite good movement, but the rotation is missing. Can you look up to the ceiling as far as you can go? Good. Okay, that's very good. No pain when you do that? No, and down. Good. Some pain on the upper back. Okay, good. Back up now. Okay, good. Now I'm going to just assist you with those movements and see if we take your muscles out of the equation, if you can go a bit further. So come around this way as far as you can go. Good. You see even more movement. So that's perfect. If we come around this way, if you're not using your muscles, you can go a little bit further. Is there pain now? A little bit, yeah. Okay, good. So those were the worst movements. We're just going to do those for now. And I'm going to just check your neck at the top and see what I can find. So we're going to do some motion palpation, which is where so this is the top level where you often get headaches. And there, yeah. So the top two levels of neck are not moving very well here. And we're going to go down and look at the cervicothoracic junction. Is it painful in there? Yeah. So this is where I know where she's getting her pain now because she's been before. So this is also a problem. The trapezius are a bit tender. Let's have a look this way. Not so bad that way, huh? Good. Trapezius a bit tender though? Not so bad? Good. It's okay. This side is. Okay, so we're going to screen your whole spine, Malak, and make sure that you haven't got any of your old low back problems either. And then we're going to come up and definitely you're going to be a bit stiff through here, so we'll do some adjustments, okay? So let's just check your pelvis. Oh, yes. Nice movement there. Good. That seems good. No pain? Good. That's good. The lumbars are moving. You're starting to get a little bit tight here. Yeah, and as always, your thoracic's up here a little bit tight. So we're going to give you some adjustments through here, okay? Okay, first one we'll do here. Take a big breath in. And all the way out. All the way, good. Very nice. You okay?
Yes.
Very good. Okay, we're going to do one up here. So we're going to put this headpiece down a little bit for you. You okay? Okay, we're going to adjust your CT junction here, okay? A little bit head over this way. And I'm going to try and see if we can move this first rib. Move your hair out of the way, good. Nice and relaxed. There you go, good. That was lovely. Right. You're tight in here in these trapezius. We'll need to give you a little bit of physio for those, okay? Very good. Okay, so for completeness, I'm going to adjust her TL junction down here and a couple of her upper thoracic levels up here with the automatic adjusting machine here. This is an adjusting instrument that has a sensor inside, and I have to pull the trigger when it's in the right position, of course, and then the machine will stop on its own and give a single whistle when it's moved the joint 25%. So it's quite important to get all the levels moving that you want to. Sometimes we can do it easily with manual adjustments, sometimes we use this. Very much depends on the patient and the area that we're adjusting. So, you're okay with this? You've had it before, haven't you, Mark? Good. So we're going to start up here. Okay with that? That's the lowest level. We're going to put it up a little bit. Good. Any pain? Really? Yeah, I could feel that was a little bit tight there. Mostly this machine doesn't give any pain at all, but sometimes if you've got a very stuck area, you might feel it as it begins to move. So the machine is stopping and giving a whistle when the machine has done its job and got those areas moving. Then I always check afterwards to see if it's got a little bit more movement than before. And it feels better to me there, that's good. How do you feel? Good? Okay?
Yes, better.
Good, you do need a little bit of work on your muscles too. Okay, great, thank you, Malak. So Malak, you've had your neck adjusted before. You know it's going to make a little bit of noise.
Yes.
And it's going to be a bit louder than down here because you're going to be hearing it from the inside of your head because it's right near the ear.
Yes.
Okay? Yes. So we're going to start with this side first. you know what to do, nice and relaxed, okay?
I will.
Okay, so we're going over this way and just let it, don't push down, just relax. Very
Wow,
good.
nice.
That was a good one. Okay, and we're coming around to the other side. And let's do this side for you. Again, just relax, don't push over here. There we go, that was just a little one. And we'll do a little one a bit further down. Let it go. Very good. Okay, good.